Hi dear colleagues and welcome to a new dental case. In this dental case I would like to talk to you about the minimal invasive smile makeover. Let's get started. Well, in this case, I would like to tell you a little bit more about the smile makeover that I did here. This patient came in with several problems. First of all, she has an impacted upper right canine. The deciduous canine is still in place right now and is covered with a bit of composite to make it look like a natural grown mature canine. There's also gingival inflammation. After receiving composite veneers, this patient constantly heard from the dentist that she wasn't brushing properly and that she needed to clean her teeth better because the gums were inflated. But I will talk about that later. She doesn't like the gray central incisor. This tooth was endodontically treated and since then the tooth has become more gray over time. And she wasn't happy with the overall aesthetics of her composite veneers and she came to me to get new composite veneers. She wants to do some orthodontics because of the impacted canine, but first she wants to replace her composite veneers. Well, I already told you what are the wishes. She wants to have ceramic veneers in the future, but first replace her current composite veneers. She wants a pleasing smile and she doesn't want any inflammation. Let's show you a little bit more of the pictures that I took of this case. When I take my smile photos, I always take a smile photo from straight on and from the lateral side. And here you can see the inflammation in between the central incisors and you can see the gray canine, the gray central incisor. And here is the photo from the other side. And when we look intraorally, we see that there's a really good oral hygiene. The gums look really nice everywhere. They are light and pink, but only in between the central incisors, and I will show you, they are inflamed. And when I use my probe, they start to bleed immediately, and I also feel the edge of the composite veneer, and I just feel a pocket around those teeth. And here again from the lateral view and the other side. And when we look at the occlusal view, you can see that the impacted canine is already a little bit erupted. She already visited an orthodontist and they are going to extrude this canine with a chain. So she will start her orthodontic treatment somewhere in the near future. Well, when I look at this situation, I thought, okay, what can I do for her so that she is pleased with the smile that she has and that we have some sort of in-between treatment until we can do our final aesthetic work. Well, I decided that there are several things that I can do, and my treatment plan was as follows. I want to do orthodontics due to the impacted canine, but I also want to do some recontouring and reshaping of the current composite veneers, and I want to do internal bleaching on the central incisor. When we go back one slide, you can see that the restorations look really dull. There is not really any surface texture in on the composite, and I think we can improve the angles, the line angles a little bit. And when I recontour, reshape this without adding any composite, I think we can get an aesthetic pleasing result. And when we do this, the recontouring and reshaping of the composite, we can also tackle the problem of the inflammation. And I will tell you in some later slides how we can tackle this problem and what's actually the cause of this gingival inflammation. And of course, after orthodontics, we have to make new composite veneers or new ceramic veneers. And if the patient is happy with the current situation, we can even leave it as it is. but I will show you the final result later. This was the photo that I took after recontouring the composite veneers. And what I did, I used different burrs to get a smoother transition between the tooth and the composite. And I also changed the line angles, I changed the incisal edges, and I did some surface texture to get a more natural looking result. Of course, the central incisor is still gray, so we also did some internal bleaching at this first appointment. You can see the gum, and the gum looks really weird right now. And especially if I go to the next slide, you can see that there is a lot of that the gums are really thick, and that there's a lot of space between my composite veneer, the tooth, and the gum. And I would like to tell you a bit more about the actual problem and what I did. On the right, we see like a drawing of an incisor. And what was going on, the current veneers looked a bit like this. So they were just smacked on without any consideration of the periodontal tissue. And when you take your periodontal probe, you can feel the ledge of the composite, and it creates a horizontal pocket. And this is the reason why the gums are inflamed. And nowadays it's really popular to get composite veneers and get an Instagram smile or a TV smile. And I often see people that have undergone those kind of treatments, and they come to me for referral or because they are not happy with the result. And 9 out of 10 times there's also a problem with the gums, and there are horizontal pockets because the biology wasn't respected and there is a huge ledge on those teeth. So what I do in these cases, I just reshape the composite. I get a flame-like burr, just a long diamond burr, and I tilt it at like a 45-degree angle to recontour the cervical part of the composite, as you can see in the next slide. Here you can see how I change the angulation of the composite in the cervical area, and by doing this we can let the gums heal and get a normal and healthy situation. And this is the photo from the other side after recontouring the composite. And you can also see that I gave it some surface texture. The central incisors were overlapping a bit. The composite was not only on the cervical part, it was too bulky, but also approximately or interproximal. So what you could see is that there was also a lot of overhang in between the teeth. And by recontouring, you could see that we now have really nice line angles, as you see over here on this side and on that side. And you see that there's a bit of the papilla missing, but that's due to the inflammation of the overhang of the restoration. And I also created a little bit of surface texture to get that more natural feel to the teeth. And then I saw the patient again after 1 week because of the internal bleaching. And I wanted to see how the gums were reacting. And only after 1 week you can already see that the gums look a lot better. Especially here on this side, you can see that it's already really nice and light pink. And on the central incisor that had the root canal treatment, we can see that it's still a little bit inflamed. But overall the result is already pleasing. And we can see that the color of the central incisor also looks better after 1 week of internal bleaching. So we decided to make the definitive restoration on the palatal side and stop with the internal bleaching. I saw the patient again after 4 weeks. First I want to show you the 1 week post-op results. You see that the papilla on the central incisor is still a little bit missing. It's still rounded off, but the gums already look a lot better. And here's from the other side. You can also see that there is that gray that gray line on the edge where the composite meets the tooth. And I think there was some sort of leakage. Maybe it wasn't etched quite well, or maybe it wasn't bonded that well. So there was a little bit of leakage. And what I did at this appointment, I took a really small diamond burr and I removed that part of the composite, and I added a little bit of new composite to blend that edge a little bit better, because the gums were inflamed. When they get healthy, the swelling will go away and we will get a little bit of a sort of recession, so to say. And sometimes this gray area can then become visible. So I removed it with a really small diamond burr, only the discolored part, and I applied a little bit of new composite to mask it and to make sure that it was pleasing. This is the result after 4 weeks. So we did some recontouring and reshaping of the composite, and we did some internal bleaching on the central incisor. Right now, we don't have any inflammation. Aesthetically, it's way more pleasing, and now it's time to do ortho. And after orthodontics, the patient can decide whether she wants to keep the current situation as it is, if she wants new composite veneers, or maybe we even go for ceramic veneers. But we will have to wait first until the treatment is done, and then we can make a new treatment plan and decide what to do. And here is the intraoral picture after 4 weeks. You can see that the gums on the central incisors look way more healthy. Even though the papilla isn't completely back and isn't completely as it should be, it's already looking way better than it was in the initial situation. And I think if I would see the patient again right now, it will even look better, because gums take a lot of time to heal properly. And here we can see a close-up of the central incisors, and you can see what the recontouring of composite can do. Only by applying or by respecting the biology, making sure that every transition is really smooth, make sure you get some nice line angles, some surface texture. And of course, I can even do some more tricks to make it even more natural, but right now it's already a huge transformation. This was my short video about this dental case. I would like to thank you for watching. If you like this video, please like it and subscribe to my channel, because it would really help me and also other dentists to find my channel. Thank you for watching and hope to see you soon. Bye!